Good morning, good afternoon, and good evening, wherever you are, and welcome to this session of Business Breeders, a live webinar series hosted by Goodman Group at Brock University. My name is Abdul Rahimi, and it's my pleasure to serve as the Director of Goodman Group in the Goodman School of Business. Goodman Group is a community-focused learning and development services provider that works to support professionals, businesses, and entrepreneurs pursuing growth through accredited professional development certificate programs, executive education programs, consulting services, and startup support. It is my pleasure to welcome you, our global audience, into today's session from all parts of this country and this globe. Those of you who are taking part in this webinar for the first time, welcome. And to our regular viewers as well, nice to have you on board once again. This webinar series aims to provide 45-minute readers filled with insightful discussions on timely topics that are relevant to businesses and everyday lives, led by our award-winning Brock faculty and leading industry experts. So, what do we have in store for you today? Well, what we have, we will touch on that in a moment, and I'll be handing the screen over to Dr. Madelyn Law. So there's the teaser, but let me just go through the format, especially for those who are joining us for the first time. Dr. Madelyn Law will be speaking for about 30 minutes, and then we'll spend some time answering your questions. And we hope to capture as many questions as we possibly can. And if we can't answer them, we will do so following this session. So please feel free to put your questions in during the session in the live chat. For those of you who may want to tweet your comments and questions, you may do so live tweet at GSB Goodman Group, all one word. And at the end of the webinar, I will provide you on details on how you may access today's webinar recording. Now, it is my distinct pleasure to introduce today's webinar lead, and that is Dr. Madelyn Law, who is the Associate Vice-Provost, Teaching and Learning at Brock University. She is also an Associate Professor in the Department of Health Sciences, and she is the Director of Interprofessional Education for Quality Improvement Programs, or I-EQUIP. Madelyn channels her passion into building partnerships in the healthcare sector to open avenues for research and experiential education for students. Her research is focused on organizational culture and implementation science to enhance the quality of existing health systems. This work has led her to contribute to quality improvement projects alongside professionals in a variety of areas, including public health, acute care, rehabilitation, primary care, and community care settings. The list goes on. Madelyn has spent part of her numerous provincial and national grants with a lens to implementation science. As if she finds time, she's also an excellent teacher, and I hear constantly and frequently from her students on how great and in tune and passionate she is about her students. Madelyn, welcome.
Great. Well, thank you so much for having me here today. I'm very excited to share some of my research passion with everyone on the webinar. Now I'm just going to share my screen to get that started here. Here we go. Just going to share that up and get that going. So we're good, Abdul?
I think it's starting to pop up. There we go, got it up.
Excellent.
All good.
All right. Well, again, thank you so much for having me here. I really appreciate the fact that you're taking some time out of your day. Hopefully, maybe just got your coffee or maybe your second one, and you're able to have a bit of a breather and take this time to maybe think about something that you haven't had the chance to do so in the past. So what I'd like to chat about today is this idea of bridging the gap between knowledge and action in organizational performance. So interestingly and serendipitously, I think this morning, as I was putting the final touches on my presentation, I noticed an email that came into my Brock account, and it was about a fantastic project with the community of Lincoln, the town of Lincoln. And it really actually sets the stage really nicely for the talk that I'm doing here today. So one of the quotes that was in this news release was from Chief Administrative Officer of Lincoln, Mike Kirkopoulos, who quoted in one of the press releases stating, "In partnership with Brock and Vineland, we collaborate with world-class researchers who can assist with understanding the multifunctional benefits of green-blue infrastructure, allowing for data-driven and informed decisions." I read that and thought, oh my goodness, he should be doing this session. And then I also saw that Dr. Ryan Plummer from Brock's Environmental Sustainability Research Center was also quoted. And he said, "In working closely with all of our partners on this project, we will generate actionable knowledge about green-blue infrastructure right here in Niagara with widespread scholarly and practical implications." Again, this is for me a huge success and demonstrates exactly what I would like to talk a little bit more about with you today in this webinar. To that end, my agenda is what I'd like to cover is just a quick intro, just a little bit about, well, why am I so interested in this? And that gets to what that problem is around this knowledge to action gap. And then I'll talk a little bit about why I think you should care, and then what you can take away from this, and hopefully something that you can walk away or click away, I guess, to get started on and work on in your own daily life. So the key takeaway that I'm hoping that you can reflect on is really how to engage and maybe even develop or implement research to enhance any aspect of performance that you are interested in within your context. To do this, what I will really kind of dive into a little bit more is the idea of using decisions or using evidence to guide decision making, as well as a number of frameworks that hopefully are really accessible and easy to apply that will allow you to generate, to implement knowledge within a local context. As well, what I think what I would like you to think about is how you can partner with researchers at Brock as well. So who am I and why am I interested in this area? Well, to be honest, I know I have all those titles, but where my academic career started out was in the area of sports psychology. So a long time ago, and although extremely enlightening, it left me just a tiny bit jaded in terms of my experience in academia. So I started out and I was working with an individual named Anders Ericsson and Jean Coté, who are both world-renowned scholars in the area of expertise. So you might recognize this name, but Anders is the individual who coined the 10,000 hour rule. So this is the idea that if you spend 10,000 hours on something, you will become an expert. And so I thought this was fantastic. I was just, fresh off of a national team, and I thought, oh, I'm going to, work on this in the area of rhythmic gymnastics of all things. And yes, it is a sport. So with that, I thought, I'm going to test out this theory and really understand what it is that makes an expert. And so I understood that this was a system, that there was aspects of training that you needed to put into this. I thought this was amazing research. I thought it was going to make a splash everywhere. I thought it was going to change athletic training around the world. And, I was just in my master's, so I got a publication. Great to get a publication, did a few presentations. But it really left me kind of saying, why is a publication great? Why is a presentation great? I really didn't get the impact I was looking for. And I feel like my work had sat on a shelf and really didn't make as much of a change in athletic training as I would have liked it to. I tried to engage with our stakeholders after I had done the research, which I started to learn is probably not the best way. And we'll talk about that when we're talking about partnering with researchers. So needless to say, I was a little bit disheartened. So I moved forward and, well, I took a little bit of time away from academia, but then I really started thinking through like my passion for being engaged in research and new knowledge and scientific evidence And I started to look around and saying, okay, what is it that we know about why this knowledge that we work on in universities doesn't become implemented in practice? And another stat that I found as I started to shift a little bit more into thinking about how do I improve the health of the population, it was the fact that generally it can take about 17 years for new knowledge generated by randomized controlled trials to be incorporated into practice. And when that's done, oftentimes it's done in an uneven fashion. So this made me even more mad, and I really wanted to be able to contribute to society through different mechanisms of research and practice. So given my roots in sport and business, and I've always been really interested in performance. So this led me to really thinking about how do we bridge this gap between researchers and practitioners to optimize performance. So why should you care? Why is this important? Well, because in business, like in healthcare and in sports, we're all looking to enhance performance. And performance should be defined individually with the goals set based on context and based on the individual. So for example, in much of my work, I'm looking at improving the performance of health systems in order to be more effective, more efficient, to be safer, to be patient-oriented, to enhance patient satisfaction. But in a business context, you may be thinking about how to improve performance of your business to enhance the bottom line or to enhance worker satisfaction in your company. So performance really depends on, again, your context and what you're trying to achieve. So here's just a really very broad definition of performance that I kind of use to drive what I'm thinking about in terms of that concept. So the action or process of carrying out or accomplishing an action, task, or function. So what we know is that there is a ton of organizational performance literature that's available. There's a lot of research that's published in journals, but by great people in academia, but it's not always easy to get your hands on. There's many articles out there that can be informative in your daily practice, but again, how do we make that bridge from reading an article to actual action? So Pfeiffer and Sutton highlighted this in a paper in 2005 in the Harvard Business Review about evidence-based management and linking this concept within healthcare. And so the quote from this article is that as with medicine, management is and will likely always be a craft that can be learned through practice and experience. So it links a little bit to that deliberate practice and the expertise development. Yet we believe that managers, like doctors, can practice their craft more effectively if they are routinely guided by the best logic and evidence, and if they relentlessly seek new knowledge and insights from both inside and outside of the companies to keep updating their assumptions, knowledge, and skills. And so for me, this idea of evidence-based management is where we're able to think about what's happening outside our own walls and bring that in, see if it can work, and make it part of our practice to improve that performance. So how can we kind of bridge this all together? So this all sounds fine and good, but how do we actually do this? How do we work together? And what are some of the frameworks that allow for this implementation of knowledge to happen in our industries, to bridge this gap? It's not good enough to just publish a paper and hope that the managers are able to read it and implement that. So what I'm going to do is just share 3 frameworks that I use in a lot of the practice activities that I do with practitioners in the healthcare setting. But again, definitely have applications across all different industries. So in health, there's a term that's been used, and it's seen as interchangeable with things like implementation science, knowledge exchange, etc. It's this idea of knowledge translation. So this is seen as the dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians. But I think you can just take out that piece around improve the health of Canadians if you were to say to improve the health of my organization or to the workers in my company. So there's a lot of different ways I think that this has a very broad application. The next slide here gives a bit of, when you first see it, it looks a little overwhelming. So I'll just show you the actual framework of the knowledge to action. And what this does is it speaks about how to take information and implement that in practice, but being mindful of the techniques in which we use to generate the knowledge, to synthesize the knowledge, as well as to make sure that it applies to that local context. This was developed in more of a health organization focus. However, when they were creating this model, they pulled from all sorts of different multidisciplinary research areas. So if you look at the other arrow that I'm adding in here, just to have you focus in on it, is this idea of identifying the problem. So what we really want to be able to do is think about what is the problem within the organization or the area that you're working in, and really be able to think about that critically. From here, you might be able to find a great piece of research that already exists, and then you're able to move into the other cycles within the knowledge to action framework to adapt this knowledge to the local context, to figure out what are those barriers to the knowledge use, to tailor it, to trial it, and then to hopefully make modifications and continue to sustain that new knowledge use. However, if the research doesn't exist, then what do you do? So at the center of the model, you can see that this is where you might feel that, well, we actually need to do a research project to really understand what's happening with this issue or with this topic. And from there, it's creating new knowledge and engaging in ways that allow industry and researchers to work together to come up with a project to allow for new knowledge to surface and be trialed and implemented. And that's really how this knowledge to action framework comes together. So an example of this is a project that I did, which was called Enabling Continuous Quality Improvement in Ontario's Public Health Units. So I worked with, at the time, there were 36 public health units that were engaged in this. Now there's only 34 in the province. But what they were really interested in was understanding how they could implement quality improvement into public health. So quality improvement from the business world, I'm sure some of you understand what those type of processes are, is small scale changes and innovation and measurement. All of those pieces have been now really highly implemented into healthcare environments. And public health was not mandated to do this, but they really wanted to get on top of this and say, how could we use these types of methodologies to improve the work that we do as Ontario public health units? So this wasn't a question that was driven by me as the researcher. They found me and said, hey, I think you're in health. We think you're in quality. You like quality improvement. You like performance. Is there a way that you, as a researcher, might be able to help us work through a rigorous model to come up with the key critical elements within structures, systems, and things like that that would help to create, support, and sustain QI in public health? So this is where that integrated knowledge translation approach happened, where I was a researcher, the practitioners had a question. There was really only about 10 articles out at the time in public health that would allow for them to glean any interesting learnings. So they wanted to do a bigger dive and a deeper dive. So we did that together as researchers and practitioners. The next one here is an example of what we did next, because as they decided, here's all the different structures and the different elements that we need to think about, where are organizations at in terms of their QI maturity so that we know how to move this forward in our organization. And so again, they could have created a small survey, did this at their own units, but instead they said, how about we come together as a collective and find an evidence-based tool that we could actually measure the QI maturity and use that to drive what our actions will be going forward. So we had fantastic response. We had 3,503 individuals across public health units in Ontario involved in the survey, which then has allowed them to also engage in other research post implementation. So doing a bit of a pre and a post, and for me as a researcher, I'm like, oh, this is amazing. They're actually implementing these great research methods and great designs to be able to see what their impact has been. So I think this is a great example of how identifying what the question is, thinking about what your partners, and bringing people together to align and do great evidence-based type of research to inform decision-making to improve organizational performance. So here's another kind of, I guess, framework that I like to pull on, and maybe it's because of my sports psychology background, but just to shift a little, this is the idea of aggregation of marginal gains. So normally I'd ask and see if anybody knew anything about this topic, but I'll just kind of go straight into it. So the whole principle came down to this idea: if you break everything up within a system and you try to improve that by 1%, then you'll see a significant increase in what the performance is. So this was done by a coach in the UK with the British cycling team. So at first they weren't really doing very well in the few Olympics, and they really wanted to get their game up for 2008 and for 2012. And so what they did is they broke down every piece of their training, every piece of technology, and tried to improve it just that little bit more, which links to this idea of the aggregation of marginal gains. So over time, if you improve one small aspect, you will see improvements. So what aspects of improving performance that they looked at were things such as their sleep. They would take their own pillows to their competitions. They would they trialed out all sorts of different uniforms, helmets, different technology. They looked at nutrition. They looked at sleep patterns. All of these pieces, just 1% improvement, garnered them major results and a lot of medals at the next Olympics. Then there's the model for improvement. So I'm giving you these three kind of frameworks that I think are really accessible and things that you can think about in practice in your organization. So the model of improvement is one. And this is one that has been in place for years within the healthcare setting. And why this one, how this links into research is that we're able to use different rigorous models to collect data and to understand when a change is an improvement. Also, this idea of how will we know if the change is improvement, sorry, that one's around the evidence, and what change can we make that will result in an improvement is where the evidence comes in, and looking at what have we done in the past in this area to improve, say, patient safety in a pediatric care unit? What's been done, and what might we be able to implement ourselves? And once we've identified a piece of that evidence, how do we plan for this? How do we trial it out? How do we study it with rigorous measures and data? And then do we act on it? Do we need to make other changes to make it even better, or are we good? And how do we sustain that? So that's really that implementation science aspect of thinking about small scale changes, testing out new innovations, and then also using sound research methods to really guide that decision making with good measures and good data. I'll just flip on this one. And I threw this picture in there because I think this is a great example of students who met this individual. His name is Don Berwick, and he was a physician leader and also policymaker who informed Barack Obama's healthcare work in the States a number of years back. And so what the IHI, the Institute for Healthcare Improvement, has done is really work to bridge this idea of how do we bring knowledge and evidence into practice, make changes that are evidence-based so that we can improve our outcomes in our healthcare organization. And so those are my two students who went to a conference and met Don Berwick. He's a bit of a guy in healthcare systems research. So what can you do? So now getting just kind of coming to the end of our discussion here today is what I would love for you to be able to do is think through what are some of the steps that might be truly important that you can take. And I have a few ideas around that. So I hope that I've inspired you a little bit to think about, okay, evidence is important. We should really be looking at that research and thinking about how do we partner and with questions that are really important to you to improve that performance of your organization. And to do that, I think if we're able to look at reflecting on what you're really trying to achieve, what is that end game? And is it implementing something new? Or you've been looking around your organization saying, well, why are we doing things like this? I think there's something better. You're getting a bit of a gut feeling on something that you know that you could do better. So do you have a question? Could the research actually already be able to answer that for you? Or does it require moving into more of a research framework? And how do you make that partnership with some of the researchers? How might you be able to test this out with one or two of these frameworks? So you might not need to have that major research partnership if you feel like you can think about some of these models and use some of these research methods in your daily practice. So how do we build that partnership? And what makes a partnership with an academic institution and the researchers so that you can really look at how can we make a change and address some of those questions? And these, I feel, are four of the key lessons that I've learned over time in building that partnership. So number one is common language. We probably spent with the public health units, even though I was in public health, but I was coming from more of a business sort of oriented research background. We needed to come up with common language that we could all understand around the table so that we built a culture of research and understanding of what the real question was so that we could truly identify where we wanted to go with the projects. The next one there is common goals. So what do we want to get out of this? And being really open and honest about this. In a researcher's world, you do definitely have to have some of those publications and grants and time to engage in research projects, whereas the practitioners might have more of a focus on, okay, we need to get this done to meet some organizational performance metrics. And therefore, understanding what those goals are and making sure that some of them really do highly overlap is going to help to build that partnership and allow for a successful project. Common strategic visions. That's a piece where I think, just selfishly, I think Brock has a fabulous strategic approach in that we want to be working with community, and we have a number of MOUs to be able to do this. So I think having that vision of supporting this work and also aligning what my interest is with what the strategic vision is of the organization. So an example of this is I work closely with Niagara Health, and their vision is to engage in research and to have students come into their organization and work on quality improvement projects. And my vision is to improve the health system quality. So it really links together when you have those strong strategic visions and what you're trying to achieve. And the last one there is making the right connection. So not every researcher is like me, who wants to be out in the field and doing things that are going to change the environment or the community. There are some who like to do some very distinct research, and their knowledge translation is maybe just looks a little bit different, and that's okay too. So you need to think about what that connection might need to be in order to ensure that you have a successful program. Now, I threw this one up there because I think it's kind of funny. When I found it, they did a scoping review to look at the enablers, the barriers, and I don't expect you to be able to see this, but they talked about what were all the enablers to having this partnership be successful, what were the barriers, what were the conditions, what approach needs to be used, and what are some of the outcomes. So they did a scoping review, looked at all the research around this, and these are the things they came up with. And I looked at that and I said, no wonder it's sometimes difficult to partner with academics, because we tend to pull together some models that look really, really complex. But if you dive down in it and have conversations, you could actually identify that there's a number of pieces in here that you would need to consider if you were working on a project. So I'm going to provide you with the link to this, because I think it's a really nice guiding model to say, oh, we could think about this one as in terms of a condition that would really support this project if you were thinking about engaging in a research relationship like that. But what can you do today? So what I think I've discussed a little bit is that, bringing together these research relationships and partnerships are really important if you're working to develop some new knowledge. But I think there's things you can walk away from here today and begin to ask yourself. So when the need for enhanced performance is being discussed, ask yourself, ask or think about, what's the evidence to support this change? has it been tested? Is there research evidence to actually support the direction that I would like to go into? Sometimes it can be a really quick search. Other times you might say, well, I think I can't really find anything here, and maybe I need to do a little bit of a deeper dig. And that's what I hope that you're able to kind of leave thinking about with the ideas of using evidence in practice. So I know that I definitely sometimes come across as a little bit idealist, but I definitely think that there's benefits, and it's really worth investing time into partnerships to engage in the development of research evidence that can really help to drive improvements in performance. So what I've gone through, and I hope that you're able to take away from today, is a little bit about the idea of guiding decisions using evidence. Also thinking about a number of different frameworks that might be useful to you as you think about generating and implementing new knowledge that's locally contextual to your situation. And as well, the idea of how you might be able to move into the space of being able to partner in a research context that will allow you to find new evidence and new information that will help to enhance the performance of whatever that topic is that you're most interested in. And I think that's everything.
Madelyn, thank you very much for that. Very insightful. I've got a bunch of questions that has come through from our audience, which is fantastic. So here are some things. First one, let's just start with this one. Where are some of the places to look for evidence-based research? And if there isn't any, how do you go about connecting with researchers?
It's a fabulous question. So I think now we do have a lot more research that's open access. So even if you were to go to a journal, a number of articles are often available right there, right on the web. There's also sometimes they have a 1 year where you can't get access to them, but then you can. Abstracts can be there that are helpful. I think the web is good, but going to targeted journal sources that are reputable is definitely an important piece. In terms of linking with researchers, I think it's a great question, and maybe our research office is online here, but going straight to a university's research office and looking up the list of researchers and what they're interested in is generally available at any university. I'm pretty sure it's available at Brock. And being able to connect that way, it might just be a conversation that needs to get started to think about, do we have a common interest? Could we work together? Is this something that people are interested in doing? And fabulous connection. You never know where it might lead, but it might not work. So it's always good to reach out and look for that information on what researchers are doing.
Good point about Office of Research Services, and we have an excellent group here on campus that do a wonderful job, and I have the pleasure of meeting with them on a regular basis, and our latest meeting on this was yesterday, so where this topic came up. So for those who are listening in, and especially for the individuals that pose that question and that may be asking the same, are thinking about the same point, please reach out to the Office of Research Services on campus, or reach out to myself or any member of my team in Goodman Group at brocu.ca, and we would put you in touch with the right folks at the Office of Research Services who are excellent at what they do. Okay, here's another one for you, Madelyn. This is about your focus on research. So most of your focus is on healthcare system. Does it cross over into other systems like Agri and IT, for example?
Yeah, I guess I focused in on healthcare just because of my interest in patient safety, but the concepts that I use come from organizational research, and I've used those within different contexts of public health or hospitals. The model for improvement actually comes from more of the manufacturing industry, so it comes from business and has definite applications. I often have conversations with people in business, just friends of ours, and they're like, oh, you do that, so do we. So I think looking at even the model for improvement, thinking about aggregation of marginal gains are definitely things that can be applied across industries.
That's a nice segue into the next question, which was around the model for improvement. So the plan, do, act study. I've seen it used wonderfully in healthcare when I was at GlaxoSmithKline and Eli Lilly and other places. So it has that healthcare touch points for the most part, even when it is manufacturing. You know, Toyota has used it as well. But it's probably not seen as being widely used in other industries. What do you think are some of the impediments to its application in other industries?
Yeah, that's a good question. And I think from my perspective, in healthcare does tend to be a very evidence-based and data-driven. So I think that is why that model has become very successful, is because they are there's a lot of research in healthcare, so there's a lot that they want to look at implementing. A lot of individuals, the culture is often motivated around research and innovation because health professionals have come through research-based degrees, or they've had to be involved in research when they were getting into their physician school, going to med school. So I think there's just a bit of a culture around the use of evidence and data in healthcare that maybe helps that model be more successful. However, I think it's a good question, but I definitely see the application in other industries.
Here's a follow-up question to the earlier piece. How can you know if the research you find is of good enough quality to move forward with implementation? What if you find contradictory evidence? Well, that will be the first time.
Yeah, no, that happens a lot. I think, well, within that knowledge to action cycle, and I didn't get into it, huge, because we only had a half an hour here, but I can definitely put some more resources in around how you would actually evaluate some of the evidence. And there's some pretty good tools out there that are really useful to say, what is the sample size? What context in which was it implemented in? So thinking about the quality of the actual study is definitely important, and there's frameworks that can be used to identify that quality. So I could provide those in the slides.
Excellent. And just another piece to add in there. So last week's session with Dr. Tim Kenyon was on the topic of teaching and learning critical thinking. And I think some of the elements that he went in there was to assess the sources of information. And he had a list of items, including looking at your own biases. We may be leading a little bit more towards a certain author, someone that we might have worked with before or have seen and read their topics. So these are all the pieces that comes into that. So how might a physician or a judge go through looking at evidence and making an informed decision? Excellent insight in there. So for those that are putting these questions in, excellent. I would encourage you to go and look at our recording of the session from last weekend as well. Thank you, Madelyn. Thank you so very much for taking the time to be with us and for presenting your content here today and on your research and providing these insightful thoughts around the framework and for taking time out of your busy schedule. I know you are leading the unit that you're leading is uniquely positioned with CPI and the work that it does with helping the university as we transition into the new norm and delivery of courses online. And there's a lot of resource that the unit has put forward. So thank you for your work there. Thank you for your team's work there. And thank you for being here today.
Of course.
Well, ladies and gentlemen, that is all that we have time for today. I want to take this moment to thank our global audience for joining us today and taking time out of your busy schedule and taking a breather to be here with us today. In the coming days, I would like you to keep your eyes on your inbox as we send you a link to the recording of this session, as well as other resources, including the slides and the additional items that Dr. Law just touched on. So stay tuned for those. They will be coming in the coming days into your inbox. I also have some breaking news. Well, news and breaking news. So the news part is that Goodman Group's professional development unit is proud and wants to let you know that the non-profit leadership development certificate program is now open. The virtual seats are there. They're ready for you to enroll. If you have any questions about the program, please let us know. The program came about from polling over 600 individuals in the nonprofit sector and has been running strong. We are into our cohort 5 this fall. The breaking part of this news is that we've had to put a cap on the number of seats that we will have, virtual seats. We want to make sure that the quality of the program that's coming in is there, and they want to maintain that high quality there. So that is up on our website. If you have any questions, I would encourage you to get in touch with us. Again, that is goodmangroup@brocu.ca or through or anyone within the team directly. I want to touch on what's coming up next. So for those of you that will be joining us, and this is the session next week of our usual Wednesday slot at 11 to 11:45. And the topic here is led by Dr. Samir Trabelsi, who was here with us a few weeks ago. He had such a great turnout from a global audience of over 20 countries. Since then, he's been a superstar. Well, he was a superstar before then, but he's acclaimed to a new level of fame. He's been asked for interviews by radio stations, and he's appeared on asked by ministries plural, to come and provide guidance and present his thoughts and topics. And he's had requests for research from other universities as well. So fantastic work, Samir. So he's going to be back by popular demand next week, Wednesday, 22nd of July from 11 to 11:45. And he's going to be talking about boards in the aftermath of coronavirus. So please join us for that if you can. Catch your breath with us next Wednesday at 11. Until then, stay well and stay safe. Thank you.